Kia ora koutou. I can see that we have a few more people joining the webinar, so I'll just leave another few seconds before I start us all off. Ha ki roto, ha ki waho. Kia tau te mauri e kōkiri nei i ngā piki me ngā heke. Ko te rangi Māori e tāku e rapu ana, ti hei mauri ora. Tēnā tātou katoa, nau mai haramai ki tēnei wāhi kōrero. Welcome everyone. My name is Sarah Jane Payne. I'm the Research Director for Growing Up in New Zealand, and it's my pleasure to welcome you all to this Now We Are 15 webinar that is being hosted by the Growing Up in New Zealand team today. I will be facilitating our session, which includes presentations from the Growing Up in New Zealand team, who will talk you through the key findings from their recent snapshot report on mental health and wellbeing from within the Growing Up in New Zealand cohort. I'm then going to chair a brief panel session. We have guests joining us today for that, and I look forward to introducing you to them later in this webinar. Before we move on, just a small amount of housekeeping for today. Please use the Q&A function available to you online now to ask any questions, to share any thoughts or reflections. We have members of our team working in the background to answer as many questions as we can live online. But we'll also be looking out for some really good questions for the panel. So please don't wait to the end to ask a question or raise a comment. We're available now to work through those with you. So in terms of the Growing Up in New Zealand study, hopefully most of you know that Growing Up in New Zealand is Aotearoa's largest contemporary longitudinal study of child and youth wellbeing. Participants in our study were recruited back in 2009 and 2010 during their pregnancy, and the Growing Up in New Zealand team have been following those children and their whānau since then. What you're going to hear about today are some of the latest findings from the 15-year checkpoint, which was a data collection wave designed really with two objectives in mind. The first objective for us as a team was to reach back out to our cohort and continue the really important relationship building work that is critical to the success of any longitudinal study like ours. The second important objective was to administer a brief questionnaire which was designed to be relevant to the age and stage of the cohort. So the cohort were 15 years at that particular time, and to explore what life is like for young people as they manage the multiple different transitions that are the hallmark of adolescence. Cognitive, developmental, social, educational transitions are all happening in complex and layered ways at this age. As has been the case since the 8-year data collection wave, we gather information directly from the young people themselves, as well as their primary caregivers, with their questionnaires covering a range of different wellbeing domains. Of particular relevance to our webinar today are the items that we collected regarding mental wellbeing, anxiety and depression symptoms, and also peer relationships. 3 weeks ago, the Growing Up in New Zealand team were really excited to be able to release our Now We Are 15 report series. So what you can see online now are the 3 reports that are available to you via our website. These reports were developed in close consultation and with advice from a range of different colleagues, partners who work in government departments and agencies, community-based organisations, and academic advisors who all share in our commitment to help make Aotearoa the best place in the world to be a child. So I do want to thank and acknowledge all of the people that have been there supporting the Growing Up in New Zealand 15-year checkpoint from the questionnaire design stage right through to the release of these reports. E mihi ana kia koutou. So with that in mind, I'm going to hand over now to the Growing Up in New Zealand team, who really are the people who've carried the work that you'll hear about today. And it's my pleasure to introduce our two presenters from the team, Doctors Rebecca McKenzie and Ben Fletcher, who are research fellows here at Growing Up in New Zealand. They'll take you through their latest findings. Kia ora, Rebecca. I'll hand over to you now.
Kia ora, Sarah Jane. Tēnā koutou katoa, tēnei te mihi nui kia koutou. E tuatahi ko Waio, he uri tēnei no Te Opori, no ngā teparo hoki. Kei tāmaki makaurau e noho ana au. Ko Rebecca McKenzie aho. So kia ora everyone. I just want to say thank you so much for joining us today. Taking time out of your busy schedules and even your lunch breaks to be here. It is a real privilege to be able to present this snapshot to you. So I'm Rebecca and I am the lead for the health and wellbeing domain here at Growing Up in New Zealand. And as Sarah Jane has said, alongside my colleague Ben, I will be sharing some insights from our mental health and wellbeing snapshot. Just before I do, I would like to give a big mihi to our whole team that have been involved in this snapshot. You will see some of their names displayed here on the screen. But there's also those that work so hard to engage with our cohort, our rangatahi, our whānau, and to keep those relationships strong. And this is inevitably a big result of their mahi, as well as those behind the scenes right now helping with all of the webinar tech that we would be lost without. So kia ora everyone, and thank you for being here. So just before we do continue, I would like to emphasize that during this webinar, we will discuss young people's mental health and wellbeing, which includes talking about anxiety, depression, and other potentially adverse life experiences. So if you are struggling with any of these, there are resources available. You'll see here on the slide, as well as a more comprehensive list available on our website. And also, please, if you need to, feel free to leave at any point. Okay, so what were we thinking when we sat down to think about the snapshot? We wanted to know what is happening for young people at this age. So as we know, adolescence is quite often described as a time of transition, but it's also a time of foundation. So during these years, young people are developing their senses of identities, forming important relationships, and learning how to navigate challenges. They're figuring out how to manage their own well-being, who they turn to for support, and how they navigate wider environments like their school, their home, and their social worlds. For many at this stage, peers become increasingly important. At the same time, they're becoming more aware of what supports are available to them, and importantly, what might not be and what might feel out of reach. So the experiences that they have during this pivotal life stage, whether supportive or difficult, can shape how they move into adulthood and influence their long-term well-being. So understanding what well-being looks like during this stage and for who is really important. Allowing us to look at these patterns early also allows us to see where the inequities may already be emerging. So with that in mind, there were two underlying aims of this snapshot, which you can see here on the slide. These were, what are young people's experiences of mental health and well-being at 15 years of age, and how do these experiences differ between groups? The second question was, what factors are associated with mental health and well-being for young people at 15 years of age? Okay, so before we get into the results, I'm just presenting here a brief overview and breakdown of the young people who are involved with the mental health and wellbeing snapshot. So as you can see, the result, we had 4,183 young people living within Aotearoa, New Zealand that are featured in this data set. If we break this down within the broad ethnic groupings, approximately 23% identified as Māori, approximately 17% identified as Pacific, approximately 16% identified as Asian, approximately 2% identified as Mila, which is Middle Eastern, Latin American, or African, and approximately 1% identified as other. These categories were collected using the total response ethnicity, which means that the young people that were grouped into any of these young people grouped into all of the groups that they identified with one exception being the sole European category, which is young people who only identified with the European ethnicity, which is a very important group, a comparative group for our analysis. If we move on to gender, within the gender identity groups, approximately 45% identified as cisgender boy, 16% identified as either transgender, non-binary, or unsure, and approximately 39% identified as cisgender girl. For disability, approximately 17% were identified as having a disability, while over 83% were identified as having no disability. Okay, and as we are laying the foundation here, I thought I would share a quick note about the tools and measurements that we used. So in this snapshot, mental wellbeing was measured using the validated Warwick-Edinburgh Mental Wellbeing Scale. This consists of 7 items, and we asked them questions about feeling good and optimistic about the future, as well as autonomy and positive functioning aspects of mental wellbeing. These mental wellbeing scores ranged from 7 to 35, with higher scores indicating greater mental wellbeing. Symptoms of depression were measured using the Centre for Epidemiologic Studies Depression Scale for Children, which is a 10-item self-report scale. Young people rated items on a 4-point scale ranging from 1 to 3, being not at all or a lot. All 10 items were then summed to create a depression score that ranged from 0 to 30, with higher scores indicating greater depression symptoms. Examples of the items asked included, I was bothered by things that don't usually bother me, and I didn't sleep as well as I usually sleep. Symptoms of anxiety were measured using the patient-reported outcomes measurement, or known as PROMIS, which is a short-form questionnaire that has 8 items, and the 8 items being summed to create a score between 33.5 and 83.3, with, again, higher scores indicating greater anxiety symptoms. Some of the examples of questions we asked were, I felt nervous, I felt worried, and I felt like something awful could happen. And lastly, relationship with friends or peers was measured using a validated 8-item scale that included items such as, I trust my friends and my friends listen to what I say. Higher scores indicate more positive relationships, with scores ranging from 8 to 40. So just before we start to get into the detail, I want to emphasize one of the most consistent findings from the snapshot. Most young people are doing well. For example, here we can see that many young people are reporting positive peer relationships. Overall, 84% say that they have good friends and 79% say they trust their friends. Across the different items, we also see that a large number of young people feel listened to, respected, and supported. For example, many report that their friends listen to what they say and respect their feelings. Now, there is a little bit more variation when we look at some of the items like opening up about problems, but overall the pattern is pretty clear. Most young people are experiencing their friendships as protective and supportive. So building on positive peer relationships, overall, we also see a generally positive picture of mental well-being. Most young people reported above average levels of well-being, and when we look at the distribution, half of the cohort scored between 19 and 24 on a scale from 7 to 35. Overall, this suggests that many young people are not just doing okay socially, but are also experiencing relatively good mental well-being, highlighting that there is a strong level of well-being across the cohort. However, experiences are varied. So although we've seen that many young people are doing well, their experiences are not evenly distributed. So I thought I would just share some of our findings here. So what we can see here are some box plots, and just briefly, a box plot provides a compact visual summary of a variable's distribution by showing its median exactly in the middle of the data when all observations are ordered from smallest to largest, the spread of the middle 50% of values, so between the 25th and 75th percentile, which is also known as the interquartile range, and the overall range of typical observations. As we can see here in figure 1, cisgender girls, transgender, non-binary, or unsure young people reported lower well-being scores on average compared to cisgender boys. And if we move on to figure 2, we see a similar pattern for disability. Young people who are identified as having a disability reported lower well-being scores than those who were not identified as having a disability. Now, we don't have it on the slides here, but we did also see similar patterns for depression and anxiety. For anxiety, we also saw that cisgender girls, transgender, non-binary, or unsure young people reported high levels of anxiety symptoms compared to cisgender boys, and that those who were identified as having a disability reported higher levels of anxiety compared to those who reported as having no disability. Again, this was similar for depression. We saw that those who identified as transgender, non-binary, unsure, or as a cisgender girl reported higher depression scores compared to cisgender boys. For those that were identified as having a disability, they reported higher levels of depression compared to those who are identified as having no disability. So just to really emphasize here that while the overall picture is positive, These differences highlight that some groups of young people are experiencing lower levels of mental well-being than others. And just to follow on from the previous slide, one interesting finding was that these same groups that we saw overrepresented in the previous slide, so cisgender girls, transgender, non-binary, unsure, and those who are identified as having a disability, reported more positive peer relationships. So what this kind of highlights is that the importance of looking at multiple areas of well-being as experiences are not universal across groups. So kia ora koutou, that concludes the results of the descriptive analysis, and I'm now going to pass over to my colleague Ben to share the results of the multivariable analysis. Go to Ben.
Thank you, Rebecca. Kia ora koutou, and thank you everyone for taking the time to be here today. As Rebecca mentioned, my name is Ben. I'm a research fellow here at Growing Up in New Zealand, and I have the privilege of looking after the psychosocial and cognitive development domain. I'm going to talk through our multivariable analysis, which builds on the findings that Rebecca just shared. To start, I'll just give a little bit of background for this approach. And while Rebecca mentioned that many young people in the cohort are doing well, we also saw a wide range of mental health experiences at age 15. So to understand those experiences, we asked young people about many aspects of their lives, their well-being, their friendships, their school environments, and experiences of discrimination, among many other experiences. And we know mental health is complex. Young people are navigating a whole range of experiences every day. And each of those experiences can shape their well-being. So the multivariable analysis helps us to better understand which factors are associated with mental health outcomes when we consider multiple aspects of a young person's life together. For anyone who may not be familiar with this kind of analysis, one way to think about it is to imagine if two young people were similar in every way except for one experience, how much would that one experience be associated with differences in their mental health outcomes? It's also important to note that the factors we consider here are not exhaustive. We're not able to capture every experience, but we do capture some key aspects that are related to youth mental health, which are also reflected in the broader literature. So one of these experiences is experiences of discrimination. At the 15-year checkpoint, we measured discrimination using an item from the General Social Survey, and we asked young people, in the last 12 months, have you been discriminated against? This includes being treated unfairly, differently, or with prejudice compared to others for reasons such as skin color, the way they dress, race or ethnicity, accent or language, gender identity, sexual orientation, religious beliefs, and disability, among other experiences of discrimination. Now, this analysis builds on what Rebecca presented earlier. And when we account for socio-demographic factors such as ethnicity, gender, disability, area level deprivation, whether or not people live in rural or urban settings, as well as structural factors such as longitudinal experiences of material hardship across a young person's life, we found that young people who experience any form of discrimination, which was approximately 20% of young people in our cohort, we found that they reported lower mental well-being, less positive peer relationships, and higher anxiety symptoms and higher depression symptoms. Now, this was a very consistent pattern across all of our analyses. These findings highlight how mental health and well-being is shaped by the environments young people grow up in, and improving these environments is something that we can all influence. So building on this, we also looked at young people's experiences of education. Now, we know that school is where 15-year-olds spend a huge amount of their time. It's not just a place for learning, it provides social interactions, opportunities for personal development, and experiences that could support or hinder mental health. And in our multivariable analysis, we looked at two education-related factors, which were school satisfaction and academic buoyancy. For school satisfaction, young people were asked whether they agreed with the statement, "I like school." This item comes from the multi-dimensional Students' Life Satisfaction Scale, and for the analysis, we grouped responses into two different groups. Young people who reported that they often or almost always liked being at school were classified as having higher school satisfaction, and young people who reported that they never or sometimes liked to be at school were grouped as having lower school satisfaction. So essentially, this measure captures how positively a young person feels about being at school. We also looked at academic buoyancy. Academic buoyancy was measured using a validated four-question scale, and this refers to how students perceive their ability to effectively deal with day-to-day setbacks, challenges, and pressures in academic settings. Together, school satisfaction and academic buoyancy give us a picture of how young people feel in school and how confident they feel managing in their school environment. Young people with higher academic buoyancy and higher school engagement reported higher mental well-being, more positive peer relationships, and lower anxiety symptoms and lower depression symptoms. Now, these results held even after we accounted for socio-demographic factors, including ethnicity, gender, disability, area level deprivation, whether or not they lived in a rural or urban setting, as well as the structural factors such as longitudinal experiences of material hardship and experiences of discrimination. And in the school environment was where most young people reported experiencing discrimination. And we know from the literature that school climates and day-to-day school experiences are modifiable, and they matter a lot for young people's mental health. Schools create a positive environment that can build belonging and support identity and relationships that may help to promote young people's mental health outcomes. Now, as Rebecca mentioned earlier, most young people reported having positive friendships. At age 15, friendship plays an enormous role in young people's everyday lives. They're a major source of connection, identity, belonging, and support. So it's not a surprise that peer relationship is linked to mental health in the literature, which is what we found here as well. So even after adjusting for socio-demographic and structural factors, and after accounting for school satisfaction and academic buoyancy, positive peer relationships were associated with better mental health outcomes, including higher mental well-being and lower anxiety symptoms and lower depression symptoms. This means that even when we consider other things happening in a young person's life, including discrimination, school experiences, and socio-demographic factors, that friendships are really meaningful. But as mentioned earlier, having a positive relationship can be influenced by experiences of discrimination or negative experiences of education. So we need to help to create environments that may promote positive peer relationships as well as mental health. Now, these findings are also reflected by what young people are telling us directly. One of my favorite parts of the very rich data we have at Growing Up is the quotes that young people themselves give us, which help to give young people a voice in amongst all the other information. Now, these are just a few examples from thousands of responses, but they highlight what having a strong supportive friendships are like, and that they're very important for young people. With one young person saying that they think the best thing about being them is that they have such amazing groups of friends that are supportive, kind, and very funny. These other quotes also recognize that we're all individuals, such as young people telling us that I love how my brain works and I'm always entertained by myself, I'm special, and I think differently to others. Many young people in the cohort also tell us that they feel like they know how to look after themselves mentally. And this is also reflected in our data, where many young people reported that they were doing relatively well. But we can also see in this snapshot that young people's mental health is linked to structural factors and environments that they grow up in, which are not always in their control. This report reveals inequities in mental well-being, depression symptoms, anxiety symptoms, and peer relationships by gender identity and disability and experiences of discrimination. Though we also see that positive school environments and fostering positive relationships may be important for promoting youth mental health. So when we pull this all together, we get a clearer narrative that starts to emerge. Young people thrive when they feel safe and supported and connected, but experiencing discrimination, barriers in schools, or broader structural inequities can negatively impact mental health. So importantly, it's about the environment that we create around young people. When we extend this to policy considerations, as young people should be free of discrimination, and we need to ensure that services and environments, including school environments, are sufficient to meet the unique needs of young people. And to achieve this, we need to have a concerted effort across agencies and ministries. But I'll leave that for the panel discussion a little bit more in depth, and I'll hand back to Sarah Jane to facilitate the panel discussion.
Kia ora, Ben. Thank you, Ben and Rebecca, for your great presentation and you know the work that you've put into developing that report. I'm sure the audience really enjoyed and appreciated your careful walkthrough of what is really a in-depth look at what life is like for 15-year-olds in the Growing Up in New Zealand cohort. So what we're going to do now is invite our two panelists to join us on screen. And it's my real pleasure to introduce them both. They're longtime colleagues and friends of Growing Up in New Zealand. We have Kirsten Sharman, who's a Principal Policy Analyst for the Public Health Agency, and who works across strategy and policy for mental health, addiction and suicide prevention. And we also have here today John Zonneville, who's System Design Manager at the Infant, Child and Youth Team, National Planning Funding Outcomes at Te Whatuora. Kia ora kōrua. Like I said, really pleased to have you both here today and your willingness to join a panel and sort of spend a bit of time reflecting on what you've just heard and what you've seen through this Now We Are 15 report, but also perhaps to think a bit more broadly for our attendees today about perhaps the role of longitudinal data or evidence really in your different work programs. So I might start by inviting Kirsten to perhaps share a few comments about the report and your insights into that, please.
Kia ora, Sarah Jane, and kia ora to the whole panel, and a big mihi for this amazing piece of research, Rebecca and the team. It's really fabulous to see Growing Up in New Zealand, you know, now 16 years on, and really showing how research can be done in an incredibly high quality way. And this 15-year-old report, we, being John and me and our colleagues, eagerly anticipated, because as many people on the panel, on the webinar may know, 15 is the age when mental distress peaks, when diagnoses peak, and when access to ICANS starts to peak, and also to our community mental health services. So this is a very important age. And just to tautoko what Ben said about this being about environments. This is about the environments young people live in. And we've now moved from, you know, the research being interesting, which it certainly is, to it being very useful for our work. So I think John and I can both see ourselves using this work in future. And I'm not sure how much you want me to talk. I'm sort of giving an opening statement, but should I hand over to John now, maybe?
Yeah, that would be great. Thank you. Thank you, Kirsten. John, your initial comments, please.
Kia ora, and thanks for having me. This is a slightly unexpected appearance. But yeah, I just want to really echo Kirsten's comments about the huge value of this this research and of Growing Up in New Zealand. And as you alluded to before, I've been a friend of this project for a long time. I guess one of the things that really sticks out for me in this is the really positive messages about young people that we see in this. And I think that's a really crucial thing to highlight, because we so often hear about negative assessments of young people and their experiences. And yet what this study shows, and what other studies have shown, is that many young people, most young people, are actually doing really well. And I think, yeah, I just think it's really important that we don't kind of contribute to that overall feeling of young people being in a bad space by not really emphasizing those positive messages. I also think it's the information that we have here about the role of environments and of peer relationships is so important for us in terms of our thinking about how we design services and responses that might support more young people to experience those positive outcomes.
Yeah,
And perhaps that's all I'll
absolutely.
say right now.
Oh, well, just on the back of that, yeah, I think that Ben also made another key point when he used the word modifiable, because in policy,
Yes.
we want to know if something's amenable to the levers that we have, which is a kind of a bit of a jargony way of saying, like, can we actually do anything about this thing? Because some things in the world you can't actually, or government can't actually do much with in any kind of meaningful way, or they can only do it if it's incredibly expensive, which means you're not doing other things. So, what this report is pointing out, that there are things in here that have a big impact on youth mental health that are modifiable by government. So school satisfaction is modifiable, academic buoyancy is modifiable, peer relationships are potentially less modifiable directly by government, but may be modifiable by supporting communities, whānau, environments, and so on. So there's definitely things in there that we'll be talking to our colleagues in the Ministry of Education about. As people on the webinar probably know, there are already a number of mental health programs in schools, and we've gone from if you think about a sort of a bullseye, we've got services that are in schools, like school-based health services and counselling in schools. Then we've got services that affect or approaches that affect the school culture, like mana ake and tuturu. But what we haven't done is gone to the furthest outer ring of the bullseye and changed the way that we do school. So that's kind of a really interesting conversation across both policy, so my end, like talking to the Ministry of Education, and also John's end, because John looks after mana ake. Maybe the curriculum of mana ake could be amended. I don't want to go into your turf, John, but I'm just saying that there's that spectrum of approaches that we can look at to implement some of these findings.
Well, I can say that some of what we're doing in Mana Ake is about helping young people have positive friendships. So, yes.
Yeah, kia ora, koro. I think that's really interesting for a couple of reasons. John, I wanted to pick up on your point, and I think Kirsten, you were going down the same train of thought, that we do see in our cohort that the majority of young people are doing well, and they also want that experience to be known. So, as someone who spent a lot of my career looking at inequities for particular important reasons, actually what we do try and do at Growing Up in New Zealand is find the balance to show the breadth of experience, and then make sure that we're able to contribute evidence where opportunities exist to lift young people up, which takes me to my sort of second reflection on your conversation just then. Very interesting, again, as academics, other people who might be on the webinar who may not be familiar with the sort of policy development process, being able to get some insights into how you might be able to receive a report and find bits and pieces of evidence and data that you can then take away into your different programs. So we might pick up a little bit more soon about that sort of evidence to policy or programming translation piece if we've got time and if you're both comfortable with that. What I might do, I did want to just pull a question back to the Growing Up in New Zealand team, and this is coming to you, Ben. I know through our policy forum meetings and workshops that we were hosting, The idea that we focus on mental well-being as well as symptoms of things like anxiety and depression was a really strong call that we heard in those workshops. I wondered if you'd share a little bit about that sort of process and your thoughts around the instruments that we have available, not just at Growing Up, but actually for colleagues at the Ministry of Health, Te Whatu Ora, and other researchers working in this very big space.
Absolutely. Thanks, Sarah Jane. Focusing more on aspects of mental well-being was definitely a priority for our Now We Are 15 data collection and reporting, acknowledging that mental health is a broad spectrum and it encompasses both well-being and ill-being. So by capturing multiple different measures that look at these different aspects of mental health, we're able to give a more whole or more fulsome picture of how young people are actually doing rather than just focusing on the negative aspects. And we saw from our mental well-being measure that a lot of people are doing really well, which is very important to note. It's also important to understand that people can still experience well-being even if they're experiencing ill-being. They're not mutually exclusive experiences. So being able to talk to multiple different measures and measure this is super important. And we've measured areas of resilience and mental well-being, depression, anxiety, and suicide and self-harm, as well as life satisfaction and other areas. So you can get above and beyond this report. We've got a rich data source that goes over many years. We've got a lot of longitudinal measures now where we can look at how these trajectories shape up over time. Yeah.
I might pick up on maybe just that last point about longitudinal measures, and it is a real strength of the study and being a prime focus to ensure we provide that sort of longitudinal look at how mental well-being develops and changes over time. And I might come back to you, Kirsten, because I know you have a real interest in the longitudinal opportunities from growing up in New Zealand. And as I think there might be questions in the webinar already about this being a sort of a snapshot in time versus a longitudinal analysis. I wonder if you could share a little bit for the audience about how longitudinal analysis can and would be useful in your program, because there's potential future data users on the webinar today. So nice to get some tips.
Yes. And yes, I always say I want more. I'm very ungrateful. But just to say, this is a snapshot and I'm very well aware of that. And you don't publish, every analysis. You have, the equivalent of rooms full of data. You can't put it all in the snapshot. But that data stays there and can be looked at by other data users. So that's the brilliant thing about the study. I think that this kind of goes back to my original point about how 15 being a peak age for mental distress and service use means that we would really like to know what has happened before the age of 15 and what trajectory kids go on. So thinking about the academic buoyancy one, for example, I don't know this, but my mind goes to parenting, previous teaching experiences. Did they have ECE? All of those kinds of things where we might be able to intervene a lot earlier. And the same with the peer relationships sort of side of thing. Like what I know, Rebecca, you said that it was quite positive that the 84% of kids reported having close friends and 79% trusted their friends. And I don't want to be a wet blanket, but I thought 79% saying that they trusted their friends was actually a bit low. And I know that's subjective. So, what has been happening to those kids? Why don't they trust their friends? Do they trust other people, but not their friends? Have they actually been abused? Or, what's happened in the past? And I'm not a researcher, so I'm not sure if this makes this easier or harder for the researchers on the screen, but really what we're seeing in this report is the complete intertwining of the social, emotional, educational, mental well-being sort of space. So they're almost ceasing to be separate domains. So we almost need to have, a big think about, what are the outcomes and then what are the pathways and where do they intersect? Because from a government point of view, we are very interested in what often annoyingly gets called sweet spots. So, like, is there a key intervention that we could be doing somewhere that would have multiple outcomes down the line? Um, all those kinds of questions sort of come up when we're looking at these kinds of reports. And yes, it's yeah, I know it's difficult for you guys because it's not necessarily cheap and easy to do the things that we want, and then we might not actually do anything with it when you give it to us, which is probably not sort of very great for your motivation. But yeah, it's just thinking about the interconnectedness of the experiences that children, young people, and their families in whānau have had over the 15 years. You've done factor analyses in different reports with different groups of kids. That might be something that somebody would be interested in doing. Are there groupings? Are there things that counteract each other or things that amplify each other? All of those kinds of questions are sort of in my mind at the moment.
Yeah, it really is rich for the picking, Kirsten. And I think in terms of our work going into these reports, we really do hope they provide sort of motivation and encouragement and create a bit of curiosity amongst our stakeholder and wider user groups so that we get some really good questions coming through that can be answered by them and their teams in the data access. I mean, John, do you have any thoughts? I noticed that, your team is infant, child, and youth. So for me, I'm making the assumption you're also very interested in the potential for early life, we'll call it intervention or early life supporters being a very important window to shape sort of later outcomes. Your thoughts on what the users of the Growing Up in New Zealand data set might be able to bring forward to really help shape your programs?
Um, Thanks for that question, Sarah Jane. Um, I haven't had a chance to really think about this, but I yeah, absolutely. We're very much interested in the. I mean, none of us become or no one becomes an adult or an adolescent without having been a younger child or an infant. And so we are very much interested in what happens right from before birth through infancy. We're particularly interested in maternal mental health, for instance, at the moment. So the information that a study like Growing Up in New Zealand can provide us to support what we do in that space is particularly helpful and going to be really important. But I guess also just bring it back to some very kind of concrete examples. Even with the snapshot information and a program like Manaake, we'll certainly be using this kind of information to help us in our relationship with our providers and with the workforce development work that we fund for that program in terms of what kinds of interventions might be useful to be supporting in schools and particularly something like that, which is much more focused on mental well-being and promoting mental well-being in school environments.
Kia ora, John. We've got a couple of questions that have come through the Q&A. So we'll open this to the group, although they're probably this first one might be best suited to Kirsten and John. So someone has noticed that one of our recommendations in the webinar was around ensuring that young people are made visible in policy settings. And so I think that the question really is around the possibilities or feasibilities of having youth-specific policies, or would it actually make a bit more sense to use data like ours and from other youth-focused projects to inform broader policy approaches, youth specific or youth within a broader approach? Your thoughts?
Why not both? That's a great question. And the role of youth in policy development has been highlighted in a number of reports in recent years, particularly by the Mental Health and Wellbeing Commission. So, we've very much taken on board that being heard and being empowered to speak to government is actually a contributor to mental well-being. And so when the Mental Health and Wellbeing Commission interviewed a number of young people a couple of years ago, they said that, yes, we understand climate change, can't do anything about it and all of this sort of stuff, but, we want to be in the discussions. And just speaking for the Ministry of Health, we do very much have a focus on lived experience. We've got a team of 3 lived experience staff who work with clinicians and policy people, and they used to be in a group with clinicians, but now they're on their own. So really recognizing the importance of lived experience, and that includes one youth lived experience person, although she is old enough to work for the Ministry of Health. So she's youth adjacent. Um, and we do a lot of youth consultation on various pieces of work. Then there's also broader government things like the Youth Parliament. So the Youth Parliament is organised by the Ministry for Youth Development, and last year they asked us to contribute some topics for select committee discussion. So we asked them to consider youth gambling, which is an area that Growing Up in New Zealand has covered, um, because youth have recently been added to the strategy to prevent and minimise gambling harm. So yes, we do try to engage youth either through existing forums or through our lived experience staff networks, or through specific reaching out for specific pieces of work. John, did I describe that all right?
When I get my mouse to the right button, yes. Yeah, I think you did a really good job there, Kirsten, and I agree. I think it's both and. I Yeah, I think the danger of having it just youth focused is, or just youth kind of policy, is that you then get the wider system thinking, oh, we can forget about that because it's all spoken about over here. So yeah, I really like it to be both. Yeah.
Elder, great. I agree. And, not either or.
Yeah.
Another question that's come through the Q&A, so I'll just read it out. One of the aspects of mental well-being/mental health that Ministry for Ethnic Communities has been looking into is access for young members of Middle Eastern, Latin American, and African communities. Are there any insights from Growing Up in New Zealand that can shed light on access? And are these insights available by ethnic grouping? So I think this is a good one for Growing Up in New Zealand. Ben or Rebecca?
We've got some data that talks to access for mental health and other health access to services. We have previously reported some of these things in earlier snapshots, which were broken down by ethnicity reporting as well. This is not something that we've looked at this particular snapshot, but we definitely have the potential to shed more light on this, for sure, as a potential future project.
I mean, that potentially is data that the ministry has. I just don't know how the coding works. But if the questioner wants to get in touch with me, I'm happy to try and put them in touch with the right people in the ministry.
Kia ora. Thank you for offering that, Kirsten, because what I was going to offer is that one of the, I suppose, limitations of Growing Up in New Zealand is that we do not have large numbers of participants who identify with this group, the acronym being MELA. So sometimes due to our the settings that we use to ensure privacy and anonymity amongst the cohort means that we have to suppress data when we have small groups. So being able to connect with the Ministry of Health and understanding what data they have is a great way in which I think multiple parts of the data system can come together to answer that really important question. So thank you for offering to do that, Kirsten. Another question from the Q&A that I've just seen. It's really a question around perhaps the connections or the relationships between the Youth 2000 series, which we know colleagues who've led that for a number of years based here at Waipapa Taumataro and at other universities, Victoria and University of Otago. Really, the question is, how do the Growing Up in New Zealand studies, longitudinal studies, and other perhaps youth-focused health and wellbeing studies connect? and what does that mean sort of for advancing the field is my interpretation. So I'll start by saying, yes, we do connect. It's one of the wonderful things about Aotearoa is we're so small. We mostly know each other. We end up at similar, if we're not working in same places, we often see each other at other events. So I know at Growing Up in New Zealand, we've really looked to the Adolescent Health Research Group and the Youth 2000 series. We try to use similar tools and items as much as we can so that we can enable comparability or comparisons between studies. And really just to, I think another important point is to understand what young people in whānau are being invited to participate in right now as potential research participants. So, ensuring that we respect whānau time, young people's times, that we're contributing to sort of a greater data ecosystem rather than replicating for participants as sort of a series of similar questions over and over again. I don't know, I know the Ministry of Health have got some very important work happening in the mental health survey space. Kirsten, I don't know if you're able to speak to that.
Yeah, absolutely. But just before that, I'll just say to the questioner that John and I are just as involved with the Youth Health and Wellbeing Survey, which is the new name for the Youth 2000 survey, as we are with Growing Up in New Zealand. And the latest Youth Health and Wellbeing Survey report is actually coming out tomorrow. So we've been busy writing lots of comms lines and notes to our elders and betters about what's in it and what it says and how important it is. And we use both along with health survey data. And what we find, or I find anyway, is that each of them has their own strengths. So, for example, the Youth Health and Wellbeing Survey has more about substance use in it. So we'll be getting that. We're very excited to be going public with that tomorrow. And we have done some internal work across the Youth Health and Wellbeing Survey with its 2021 iteration, looking at correlates between things like poverty and mental distress. So then we can sort of look at the Growing Up in New Zealand survey to say, well, does this look like it's making any sense? We don't want to actually have each survey doing, because we're such a small country, we don't really want to have surveys replicating each other. I guess in a bigger country, that would be quite good because then you could be, you'd basically have a larger sample. But in New Zealand, we'd rather have surveys and studies that are comparable and complementary rather than trying to do the exact same thing. So on to the Child and Youth Mental Health Prevalence Survey. So all of the data that we see about youth mental distress that's often replicated in the media with saying, these people are mentally ill. We don't actually know that because mental distress is not the same as mental illness or disorder. So we don't actually know how many children and young people, or actually any age people in New Zealand, are mentally disordered or ill, other than looking at our service use, which isn't very useful because we can't guarantee that every person who needs a service uses a service. So the last time we collected that information as a country was in 1996, which is quite a long time ago. So the Ministry of Health is currently setting up a survey to happen this year that will actually look at the prevalence of mental disorders in New Zealand. And it's going to be whole of population, but we'll be starting with child and youth. Both because that makes sense chronologically, but also, as I like to think, because children and youth are so important.
Kia ora, I agree. I'm just mindful of the time. We're 1 minute to 1, and as Rebecca mentioned, we know that people are very busy and are probably giving up their lunchtime to be part of this webinar. So I will thank our panelists briefly just now for their time and their contributions, and just share a few little wrap-up messages before giving some final thanks. So the first message that I wanted to share is around data access, and we've talked a lot about the possibilities and the potentials in Growing Up in New Zealand. So for anyone on the webinar who's interested in understanding how they can access the 15-year data set or any of the data that we've collected over time, We do hope you'll join us at the Now We Are 15 Data Access Workshop, which is going to be held next Tuesday between 12 p.m. and 1 p.m. You can register for that workshop via the Growing Up in New Zealand website. And I believe, just like the webinar today, we will record that session and make it available if you're not able to go there. So please do go along. We need really great questions in order to ensure that young people have everything they need to flourish. My second set of messages is really my chance to acknowledge a very large and important group of people, starting with the Growing Up in New Zealand participants, the more than 6,000 young people in whānau who have volunteered and stayed committed to the Growing Up in New Zealand study over time. Everything that we do here as a team and in our reports is a reflection of their generosity, not just to be participants in a research project, but their belief that Aotearoa can be a really great place for them, their children and their mokopuna. So e mihi ana kia koutou katoa. To our funders, MSD, and our hosts here at Waipapa Taumatarau, Faculty of Medical and Health Sciences, we're very appreciative of your support. The Growing Up in New Zealand team, Rebecca mentioned the huge amount of work that goes into what we produce in these reports. And just a little plug to say, if you're out and about in the community this year and you see the Growing Up in New Zealand team, we will be back out interviewing whānau Growing Up in New Zealand participants for the 17-year data collection wave from May 2026. So if you see our field team out there at events, please do stop and say hello. My thanks especially to everyone who's participated in our webinar today, to Ben, Rebecca and the team for their work, to Kirsten and John for bravely coming on and being part of our panel. We really appreciate it. We rely on relationships with government to help with our translation objectives. To our New Zealand Sign Language interpreters, Rangi and Laura, thank you so much for supporting our kaupapa and our viewers. We really appreciate you. And finally, to everyone on screen and in the audience, e mihi ana kia koutou, thank you for your time and all the work that you do to support children and young people in Aotearoa. Kia ora tātou.